Hello everyone, today we'll discuss about cranial nerves. As we all know, there are 12 pair of cranial nerves. They are first, that is olfactory, second optic nerve, third oculomotor nerve, fourth trochlear nerve, fifth that is trigeminal nerve here, sixth M.B.B.S nerve, seventh is facial nerve, eighth that is vestibulocochlear nerve, ninth glossopharyngeal nerve, 10th is vagus nerve, 11th that is spinal accessory nerve, and 12th is hypoglossal nerve. Now, amongst all these 12 cranial nerves, 1, 2 and 8, that is first that is olfactory, 2 that is optic, and 8 that is vestibulocochlear nerve. These three are pure sensory nerves. They have sensory fibers only. 11 and 12, that is spinal accessory and hypoglossal nerves. They are pure motor nerves. They have only efferent or motor fibers. And remaining, they are mixed cranial nerves. Let us discuss one by one. Starting with olfactory nerve. As we have discussed, it is pure sensory nerve. So it has sensory or afferent fibers only. They carry information regarding olfaction, smell, sensation. Second is optic nerve, which is also pure sensory nerve, and it also carries sensation of vision. You can see here. Third cranial nerve, oculomotor nerve, it is mixed cranial nerve. 3, 4 and 6 cranial nerves, they innervate extraocular muscles and they are responsible for the movement of eyeball. So we will learn them together. Oculomotor nerve. Afferent fibers of the oculomotor nerve, they carry information from the proprioceptors of the eye muscle. And efferent fibers of the oculomotor nerve, they innervate extrinsic muscles for the movement of eyeball. So eyeball movement, lateral, medial, upward, downward, is because of motor fibers of 3, 4 and 6 cranial nerves. Also third cranial nerve innervate intrinsic muscles for the pupil constriction. So pupillary constriction also requires intact oculomotor nerve, and it also alters the shape of lens. Fourth cranial nerve, that is trochlear nerve, which is also a mixed nerve. Afferent fibers of fourth cranial nerve, they carry information from the proprioceptors of the eye muscle, and efferent fibers, they innervate extraocular muscles, that is extrinsic muscles for the movement of eyeball. Sixth cranial nerve, which is M.B.B.S nerve. Afferent fibers from the sixth cranial nerve, they carry information from proprioceptors of eye muscle, and efferent fibers innervate extrinsic muscles for the movement of eyeball. Now fifth one that is left. Fifth, that is trigeminal nerve, which is a mixed nerve. Trigeminal, it has 3 divisions: ophthalmic, maxillary and mandibular. So this 3 divisions, they carry information. Afferent fibers, they bring sensation from head and neck. And efferent fibers, they innervate muscles of the mastication. Chewing or mastication requires this efferent fibers from the trigeminal nerve. Seventh cranial nerve, that is facial nerve, which is again a mixed cranial nerve. Afferent fibers of the facial nerve, they carry taste sensation from anterior 2/3 of the tongue. And efferent fibers, they innervate skeletal muscle of the face, that is facial nerve itself, the name suggests, as well as they also innervate muscles of swallowing, also innervate nose, palate and lacrimal and sublingual and submandibular salivary glands. Vestibulocochlear, as we have discussed, 8th cranial nerve, which is a pure sensory nerve, so it has only afferent fibers. It has 2 divisions, vestibular and cochlear. Vestibular division is concerned with the equilibrium function, and cochlear division is concerned with the function of hearing. Ninth cranial nerve, which is glossopharyngeal nerve, which is also a mixed cranial nerve. Afferent fibers of the ninth cranial nerve, they carry taste sensation from posterior 1/3 of the tongue, and they innervate muscles of swallowing as well as parotid gland. Vagus nerve, which is also a mixed cranial nerve, and afferent or sensory fibers of the vagus nerve, they carry information from the receptors present in the thorax and abdomen, and efferent fibers or motor fibers, they innervate viscera of thorax and abdomen. Vagus is responsible for 75% of parasympathetic outflow, and most of the viscera of thorax and abdomen, they are innervated by vagus nerve. 11th, that is spinal accessory nerve, which is motor nerve. So it has only efferent fibers. You can see here. And these efferent fibers, they innervate neck muscles. 12th, that is hypoglossal nerve, which has only efferent fibers, and these efferent fibers innervate tongue muscles for the movement of tongue muscle during mastication as well as during speech. So now here you can say tongue has different nerve supply for different functions. Which are the functions of tongue? Tongue is important for taste sensation. General sensations are also carried out by tongue. General senses like touch, pain, pressure, temperature. And tongue is also for mastication, chewing and speech. Now, different nerve supply to the tongue. Taste sensation. Taste sensation from anterior 2/3 of the tongue, they are carried out by facial nerve, and posterior 1/3, that is carried out by glossopharyngeal nerve, as we have discussed. General senses, touch, pain, pressure, temperature, they are carried out by trigeminal nerve from the tongue. Movement of the tongue during mastication and during speech, that is regulated by hypoglossal nerve. So this is about different cranial nerves. Thank you.